Greetings! I'm Dr. Charles Hong, and I'm a pediatric surgeon with the Colorectal and Pelvic Center at Children's Health in Dallas. Our center was created to care for children born with complex bowel and pelvic conditions such as anorectal malformations, Hirschsprung's disease, cloacal exstrophy, and sacrococcygeal teratomas. We run a bowel management program for children who have constipation and incontinence after their surgical repair. These children often need help cleaning out the poop from the colon or bowel. Cleaning out the poop from the bowel helps stop accidents and treats long-term constipation. We made this video to guide you on how to give a large volume enema at home for bowel management. A large volume enema is a way to give liquid medicine in the rectum, where poop comes out, to clean out the colon. In this video, we will explain to you how to give a large volume enema. Your child will benefit from these daily enemas because they will be able to fully empty the poop from their bowels. They will feel better because they can now go to school and take part in other activities without worrying about having accidents. Before you begin, gather your supplies. You'll need a 24 French Foley catheter, a 30 milliliter luer tip syringe to inflate the balloon on the catheter, a 60 milliliter catheter tip syringe to clean the Foley catheter, some water-soluble lubricant to help insert the catheter more easily, a gravity bag and tubing to give the enema, the enema solution, and how much and the type of solution will be decided by your child's doctor, some fun distraction materials like books or videos, pillows and towels to help position your child. Begin by washing your hands. It is important to test the balloon on the Foley catheter before each use. You will do this by attaching the 30 milliliter luer tip syringe to the balloon port and pushing 30 milliliters of air into the balloon to make sure it inflates. Then pull back on the syringe to remove all the air from the catheter. Prepare the enema solution using the ingredients ordered by your child's doctor. Before you pour the ingredients into the enema bag, be sure to clamp the tubing. Pour the solution into the bag right before you give the enema. Some of the enema ingredients will clog the tubing if they sit there for too long. Mix the enema solution by gently massaging the bag. Do not shake it. Then hang the bag on a hook. Use a permanent marker to mark a line on the Foley catheter at 4 to 6 inches as instructed. This is the part that goes into the rectum. Then attach the Foley catheter to the enema bag tubing. Unclamp the tubing and allow the enema solution to fill the tubing and the catheter. Then reclamp the tubing. Place water-based lubricant on the end of the Foley catheter. You now have your supplies ready. Next, you should place your child in the proper position to receive the enema. This is very important so that the enema works well. If your child is between 2 to 12 years old, have your child lie on their side and pull their knees up to their chest. For children older than 12 years old, have them lie on their knees with their head on a pillow and the buttocks up. Gently put the lubricated Foley catheter 4 to 6 inches into your child's rectum. Guide the tip of the catheter towards their belly button. hold the catheter at the line so that it stays in the right place. Using the 30 ml syringe, inflate the Foley balloon with about 30 ml of air. Then remove the syringe from the port. Pull back gently on the catheter until you meet resistance to prevent leaking. Next, unclamp the tubing and let the enema solution flow. Keep the lid of the enema bag uncapped at all times. This will help the solution flow better. It should take about 3 to 5 minutes for the enema bag to empty. If your child complains of cramping, slow the flow of the solution by closing the roller clamp on the tubing a little or lowering the enema bag. Your child may feel like they have to use the bathroom while the enema is flowing in. This is normal. Have your child take deep breaths to distract them. Once all the enema solution has been given, clamp the tubing. Have your child stay in the enema position for 5 to 10 minutes. Set a timer. During this time, your child may have a feeling of urgency or mild cramping. This is normal because the solution is irritating the bowels for the enema to work properly. After 5 to 10 minutes, have your child sit on the toilet. You will remove the Foley catheter after they are on the toilet. Connect the 30 ml syringe to the balloon port to remove the air from the Foley, then gently pull the Foley out. Have your child sit on a toilet for about 45 minutes to allow the enema, fluid, and poop to come out. Make sure you have a step stool to put under their feet and a padded toilet seat for comfort. Use items to distract your child while they sit on the toilet. You will need to clean the enema bag and Foley catheter after each enema. You can rinse the enema bag with tap water, then use soapy water to clean the Foley. Use the 60 ml catheter tip syringe to flush soapy water through the Foley. Let everything air dry. Lastly, wash your hands. Giving an enema can be scary at first for you and your child. Here are some tips that other parents have found helpful. Be honest with your child. Children cope better if they know what to expect and why things happen. You should validate your child's feelings and help them understand that some things need to be done to help them feel better, even if they are not always fun. Be patient with your child and keep calm during the process. Set rules and limits. Don't apologize for the process. Let your child know their condition is not their fault and that their treatment is not a punishment. Allow your child to be involved. This gives your child some control. Your child can help mix the enema or test the catheter balloon. Have your child rest their feet on a footstool while sitting on the toilet so their knees are higher than their hips. Distract your child with a special fun kit filled with videos, toys, or books that are only used during the enema. If the enema solution leaks out, gently pull back on the catheter while giving the enema and while the enema is being held in. You may also put extra air in the catheter balloon to make a better seal. Increase the amount of air by 10 ml at a time until you have a good seal. You may inflate the balloon up to 75 ml. In order to stop accidents, it is important to give your child their enema at the same time every day. You can do this. Over time, you'll become more confident and the enema process will get easier for both you and your child. Your child will quickly overcome the fear of the enemas because they will feel better, and this will become a positive experience. We're here to help you and make you and your child successful with this process. If you'd like additional information or resources, please visit our website at childrens.com/colorectal. Thank you for watching our video.